Hi, I'm Kim McCarl, the Communications Officer for Contra Costa Health Services. Our department has been fielding many questions since we announced the extension of the shelter in place through the end of May. I'm here with Dr. Chris Farnitano, who's the Health Officer for Contra Costa County, to talk about a variety of topics that people have been asking about. We're working hard in Contra Costa County to expand testing opportunities for everybody. Right now, we're testing somewhere between 300 and 500 people a day, but we really want that number to be much bigger. What is our goal in terms of daily testing?
Our goal is really to get up to about 2,000 tests a day. So that's several times more than the testing that we're doing now. We feel confident that if we can get to that level of testing, we should be able to be identifying most people who have symptoms, as well as a large percentage of the people who don't have symptoms but do have coronavirus. And that includes people who are out in the public who might be working close to high-risk individuals, like working in nursing homes or in healthcare, might be first responders or folks working in retail where they have a lot of contact with the public, might be exposed. And we are now learning that a lot of those people don't have symptoms and may not ever develop symptoms, but they could still potentially pass the virus to other people.
So this is a significant change in what we've been doing. Previously, we've said you had to have a doctor referral, you had to have clear symptoms before you could get a test. This is a significant shift. Mm-hmm. So I just want to be sure that people are really clear. Do I have to have symptoms or have a note from my doctor in order to get tested?
No, you do not. We really want to make it as easy as possible for anybody who wants a test to get a test, whether they have symptoms or do not have symptoms. Many of our providers in the community are offering tests, but if your provider is not offering a test, we do have our county testing sites where anyone can get a test. If they don't have insurance, there won't be any charge. Otherwise, it'll be billed to their insurance, but it won't be any cost to the individual. And you don't need a doctor's order. If you want a test, you can get a test.
So when I call for an appointment, and it's important for people to know they need an appointment to go and get a test, I will be asked about my insurance, and my insurance will be billed if I have coverage. But no matter what, the test won't cost me anything. Is that true?
That is correct.
Another thing we're getting lots of questions about is antibody testing. So I wanted to ask you a little bit about whether that's worthwhile and if we're recommending that.
Antibody testing is really something quite new, and we're still learning about what antibody testing means. There are several tests that are FDA approved, but there's many more tests that are not FDA approved that are out there in the market, and there's a lot of concerns about the accuracy of those tests. Even the tests that are FDA approved, we don't really know what that test means for an individual person. So if I have antibodies to COVID, does it mean that I'm immune? We don't know that. If I am immune, how long does that immunity last? We also don't know that either. So we are working on some research studies, partnering with local research institutions to study how common these antibody levels are, which might give us some idea of how much the virus is spreading within Contra Costa County. However, for an individual, knowing your antibody test is positive or negative doesn't really tell you that much as far as immunity goes at this point.
So for more information about testing in Contra Costa County, we encourage you to go to our website at cchealth.org or to call the number on your screen for an appointment. We want to thank Dr. Farnitano for being here today to help us understand these questions. There's a huge amount of information available on our website at cchealth.org, and we update it constantly. We really encourage you to spend some time there looking at our frequently asked questions, and then also to let us know what questions you have so we can do a better job of making sure that whatever information you need is included on our website.